All right, we are back for another Fellows in Focus, this time with Amin Firoozmand. I've worked with you on service before, but I'll be honest, I have a lot to learn about your background. I do know a few things about your sporting habits, but I'm looking forward to this session. So let's get started. I want to hear about your upbringing, where you grew up and kind of the pathway that led you to ultimately the University of Minnesota.
Sure. So I grew up in Iran. So in a family of mostly like physicians, especially on my mom's side for a few generations, almost everyone is a physician. So I grew up with that dream of like coming to US for better education and becoming a really good doctor. So as a kid, and I had a lot of support from family. And when I graduated from medical school, I started to send an email to some like oncology folks in the US. So I got the position as a postdoc research fellow in Baltimore at Hopkins, and that's how I came to United States back in 2010. So after that postdoc research fellowship, I did residency in University of Maryland, and then I did my first fellowship in Cleveland. It was in bone marrow transplant, which is my main area of interest, and I worked a few years as a hem-onc hospitalist there. So, and then I kind of like decided to apply for HEMONC. And so I think honestly that was one of the best decisions I have ever made to kind of like rank University of Minnesota as number one. And now I'm a third year here. So
That's awesome. I actually didn't know that you had done, I knew that you were interested in BMT. I hadn't realized that you had actually done work in that before you got here. That's
yeah,
awesome.
just 1 year fellowship and few years of work. Yeah.
Okay. Going back to say it was on your mom's side or maybe it was just exposures within your educational pathway, which has obviously led you all across the world. Was there something that stuck out for you specifically for hematology oncology or even more specifically BMT that made you fall in love with it?
Sure. For hematology oncology, that was also a little bit of like family background that few of my family members unfortunately like had cancer. And then I was kind of like really closely following with them. And so it was really fascinating as a kind of like medical student to see how like oncologist has that much of an impact in someone's life, in their family. So I really became interested in oncology. And then as a hemonc hospitalist, so my kind of mentor was a BMT physician. So on my time off, which is like 1 week on, 1 week off, I used to go to his BMT clinic and I became really interested in like bone marrow transplant. And as you know, like University of Minnesota is like one of the pioneers in like a lot of types of like allo transplant, haplos and allos and cord transplant. So kind of, I think that was the right decision for me to choose
That's
University
great.
of Minnesota. Yeah.
And it's pretty it's a nice little luxury to be able to see it out as an outpatient too, right? And most of the time we get it only as inpatient in training, and that comes with a lot of morbidity and sometimes mortality, but you sort of miss the reality that a lot of times it's people are getting a lot of their care outpatient, particularly outside of those first few weeks.
I really think hematology, oncology, and particularly the hematology part is really rewarding. You get to know your patients, follow up with them, and it's like a continuity of care. And then you see the results. And so that's great.
Mm-hmm. So as you've alluded to already, you're a big champion of the University of Minnesota, as am I. What specifically stuck out to our program that was really that kind of that cementing of us being the place for you?
I think mentorship. So I would say mentorship is there in solid tumors, classical heme, malheme, and BMT. But for me, that was like mainly BMT and malheme because that's going to be my career. So we have excellent like mentors in any area of interest, no matter what the fellow is interested in. And people are super nice. So it's easy to work with like everyone, nurses, nurse practitioners, pharmacists, attending, co-fellows, residents. It's a pretty nice academic environment. So it's fun to work here.
That's good. I know that we all the way up from Ann Blaze and on down through the different section heads really work to make sure that that the fellows and even us as junior faculty and senior faculty have a collegial and mentorship kind of environment, whether it's near peer or in the classical or the traditional educational pathway, that there's those resources around you. It's, in other words, it's competitive, but it's competitive in a collaborative environment.
Exactly, in a nice environment. Yeah.
Yeah. So I want to hear more about that research. As your third year, you're deep into it, I presume. But I admit I don't have a good sense of some of the details of your work. So do you mind sharing that with me?
Sure. So my area of like research interest is like outcomes of like BMT and CAR T. So there was this main project that long time ago, one of the faculty here started and presented in like 2014. So when I came, there was a lot of data and was like really easy to put together, gather more information and do the analysis. So it's more about the outcomes of like cyclosporin-free regimens for allotransplant with reduced intensity conditioning regimens. So which was kind of the idea sort of came from University of Minnesota like 15 years ago. And then we are just updating and changing some components, some of the drugs. And we have a good database now to report the outcomes of this transplant. So that's one of the main projects that I kind of presented in ASTCT, like tandem meeting last year, and I'm writing the manuscript. And other than that, we have a lot of faculties that are really into clinical trials, and that was one thing that I wanted to kind of be involved in. So I'm working with a few faculties in LOIs and writing phase ones and like working with drug companies, which is a really good learning experience because that's the only way to learn this stuff is by doing it and trying to help someone, faculty, and from that mentorship. So I think I learned a lot. And also on top of that, there were like a few really, really unique GVHD and BMT cases that kind of I reported and I sent it to European Society, which is accepted. It's in like Denmark. So kind of everything. And yeah,
It's good. So
but
you're already getting published, which is awesome. And you're staying busy. No question about it, which is great. That's exactly where we want you to be as faculty. Productive, but most importantly, enjoying what you're doing. Right?
Exactly. That's the key. Like, yeah, enjoying what you're doing. Yeah. Which
So,
most of people here are kind of enjoying what they're doing. So that's nice.
I hope so.
Yeah.
We hope to sort of show, and I think hopefully also in the growth of our programs that that there's not a reduction, if there's generally a growth, and that's because we like being here, but we also like what we're doing and have that breadth of flexibility to accomplish those goals, whether it's academic, professionally, academically, educationally, etc. So as you said, you are a third year, so you, I presume, are thinking about next steps. What do you think the next step holds for you in that early faculty role?
So I think the way I see myself is like working in an academic like environment. So I have most of my family in Texas and California. So I'm just kind of like just started. So to talk to some people in different programs in Texas and California, because mainly because of my family are there. But kind of I'm looking around for a really good spot in like BMT that I can do my research, that can clinically learn from mentors and see patients and enjoy. So that's gonna be the next step. But still I'm working on it. So
Good. So it sounds like I don't I maybe missed this or didn't appreciate this before. Like you said, you're Iranian, you grew up in Iran, but you have a lot of family here in the States. Is that right?
so in Orange County, in Orange County in like California.
Okay.
So it's kind of like there's a joke, instead of Los Angeles, they call it Tehrangeles
Got it.
a lot of them, yeah. So
that's interesting. I didn't realize it was such an Iranian hotspot.
yeah, and my dad's side of family are mainly like Austin and San
Okay.
Antonio. So
Got it.
kind
Okay,
of,
so that's nice. So
yeah,
you do have those
yeah,
connections across the country
exactly, yeah.
that gives you a lot of flexibility. If you put yourself now maybe 10 years down the road and you've kind of gotten your feet under you career-wise, what kind of practice do you see yourself doing? And I mean by that clinical trialist, bench scientist, outcomes work? I kind of want to get a sense of that in that longer term view.
So probably a combination of outcome work in like BMT, CAR-T, and trials.
Got it.
So, yeah.
Awesome.
I've done like at Hopkins, I did 1 year of like bench research, but I would say probably the one which is closest to me and the way I'm thinking is more like a clinical trial, and it's sort of like outcomes research.
Good. Yeah, you want to do something, I mean, I did bench research as a fellow as well. And it was it was valuable in a lot of different ways, but I also said pretty clearly bench is not my forte. And not the thing I see myself doing long term. So there's knowledge to be gained in all those experiences, but realistically, you want to find yourself in a career path that you find the most fulfilling. And thankfully that there is a lot of flexibility within our field to do that. And I hope that you've seen that in the breadth of different faculty you've worked with, that you can do that at, particularly at our side, but just generally speaking, even within the sections, you can subspecialize or build niches.
Exactly. Yeah, which is really nice. It's so cool that you can still know the general things, but be more focused on specific type of disease of your interest, which is really good.
I was going to say, we hope we can model that there's a lot of flexibility in careers. There's not a single way to do things. You talked about mentorship a couple of different points back, especially in your guidance to getting here. Can you name one or two mentors, and whether they're in medicine or not, or here or other places? But
sure,
how have they really formed your professional and personal growth and development?
Sure, I think mentorship, as you just brought it up, is the single most important thing. So, and before coming to University of Minnesota in Cleveland, so my BMT mentor was Dr. DeLima. So he's a close friend of my current mentors here. So, and he really helped me to kind of understand the field and know what I'm kind of like interested in doing like in the future. And the other mentor was Dr. Mitchell, which at that time Navneet was the kind of like president of Society of BMT, but then he became the president of like Sarah Cannon, which is kind of an academic BMT place, So these two people really helped me to kind of like find my way and see what are the steps I need to take. And during fellowship, there are lots of mentors. If I want to name, there should be a lot. So, but yeah, Dr. Jacket and Dr. Macaron in particular, these two. So I do a lot of clinical and research with these two. But clinically, almost everyone in hematology and BMT are my mentors, because I do a lot of like clinical work with everyone.
I'm glad that you have those connections from your previous training spots that you can still connect with. And then also that folks like, Joe Macaron are, despite being young faculty, that you find that value in them being mentors. That's something that I, in that same, very, very much that same role, having started at the same time as Joe, appreciate that, it's a responsibility for us, but we hope that we're fulfilling that role for our respective trainees. So.
Yeah, that's awesome. And I really appreciate that these guys have really busy clinics and everything, but they still take time to once a month or so sit down with me and kind of talking about my goals and the projects and everything. And also I want to name Dr. Joe Hagerar. I'm not sure if he's a really great mentor to all of the fellows. So
he is.
He's
he is
so
nice.
Passionate. So passionate, so knowledgeable, and so nice.
Yeah. And if you're ever having a bad day, all you have to do is talk to him, and he'll start laughing or smiling.
Yeah. Exactly.
I remember that as a resident, even working with him.
Yeah.
Despite being at Regions, he's a huge supporter for our program, and
exactly.
It's being an adjunct faculty essentially, or sort of an offsite faculty, I guess. He's really passionate about that education.
Very passionate, very nice. And he's super nice in a way that like I still do clinic. I've been doing clinic Tuesdays with him for a year now. But he knows that my area of interest is like hematology, yeah, and BMT. So he tries to put heme patients, even classical or malhemes, on that Tuesday, which is so nice of him. That's a lot of work for him to just put those patients on that day, which is really great. I appreciate that. Yeah.
That is good. Well, you've delineated a super busy work schedule, but I hope you find time to do fun stuff outside of work.
I
What are
do.
your hobbies and interests outside of work?
Yeah, so I play a little bit tennis.
Yeah.
Yeah.
I know
And
you and Manish have talked about it before.
yeah. Yeah. So, and pickleball. So first year I was playing for this club here, like tennis, but then second year I thought that maybe I'm too busy to commit to like a specific schedule to play for a club. So I just play for fun. So whenever I have time, like tonight, 8 to 10, I'm gonna play tennis, which is the weather is so nice. So why not? Yeah.
That's good. Yeah, you got some extra good weather persisting deep into September, which is nice for you.
Yeah, it's still October, just for the new upcoming fellows. October, November is still nice. The only cold is mid-December to mid-February.
Yeah.
These 2 months you should just work and go home. Then it gets better.
I go do cross country at that time. I ice
Oh,
skate.
that's good.
Yes.
That's good.
It certainly takes bundling up in it. But I think you find that people around here, they're gonna be outside regardless of the
Yeah,
season.
exactly.
Like,
People who are used to that. So for me, for the most part, those 2 months I do like indoor sports. So I try
Right.
to swim and just like
Okay.
But I've seen you're right, a lot of people are biking outside and stuff. So they are like used to kind of like cold weather. But honestly, it's just 2 months, and out of those 60 days, maybe 30 days is cold.
Mhm.
So and that's okay. The
Yeah,
rest of
exactly.
the year is so nice, yeah.
So if you weren't a physician, what would you be doing? What would your career path look like, do you think?
So I have this kind of like license to teach pickleball. Maybe I would be a pickleball pro, yeah. So
Pickleball, official pickleball coach. That's
maybe,
awesome.
yeah, yeah.
Does Manish play with you too? Or
I don't think he plays
oh,
pickleball, but
okay.
he plays tennis and plays very good tennis.
Yeah, I know. I think he undersells how good he is. Is my I've never played with him.
Yeah,
But
he's super
knowing him
great.
and
Yeah,
hearing his
yeah,
discussions, I think he undersells how good he is.
yeah, yeah. He's a very nice human being and a very good tennis player, both.
There you go. All right, the last question I like to ask everybody, because honestly it gives me thoughts for future travel. If you were, I like to put people in a travel agent role. So if you're a travel agent, where should I go and why? Give me one place I should go visit.
So if you want to go right now in September, I would recommend Montreal.
Okay.
Yeah, in 2 weeks I'm going there. It's
Oh,
like
that sounds
so
great.
nice, and there's like, yeah, live music outside, and it's like very good time right now to go there.
That's good.
So
I say I've been to Montreal, but for a conference, and I didn't have my own. I was kind of stuck around the convention center. So I'll be honest. I've landed there. I've seen some of the downtown area, but I'd love to see it more.
yeah, and if anyone wants to travel in summer, I recommend anywhere in Midwest. That's so nice. Anywhere. So
Perfect.
yeah.
Well, thank you, Amin. This has been a
Thank you,
pleasure.
Dr. Boucher.
I,
Thank you very
I
much.
love
Appreciate it.
chatting with you. You always bring a hearty sort of joy to conversations and things like that.
Thank you. Thanks
So
for
I hope you have
time.
a good rest of the week, and thanks again for doing this.
Thank you. Have a good day.
All right, you too.
Bye, Dr. Boucher.